November is Prematurity Awareness Month, and take a look at this number from the March of Dimes. Now, every year, 1 in 9 babies are born too early here in the United States. WAT 6 on your side anchor Lori Tucker is on your side tonight with what mothers can do. Lori.
You know, Kristen, we just don't know what causes premature birth, but there are some steps that mothers can take to reduce the risk that their baby will be born too early. And joining us now from Children's Hospital is Nikki Parton, who is a nurse in the neonatal intensive care unit. And before we came out here, you were telling me how much you love your job, and we love that you do that for our babies. First of all, what is considered premature?
Premature birth is any delivery before 37 weeks gestation.
Okay. And so depending on which week can determine what kind of problems the baby will have. What kind of care do preemies receive?
There is such a wide variety of things that prematurity and challenges that premature babies face. The main thing is their lungs, so a lot of them will be on ventilators, need some help with that transitioning. Also, they're not have enough body fat to stay warm, so they'll be in incubators and little isolates, as we call them, to keep the temperature warm enough inside so they can maintain their temperature and save calories and not waste all their calories to gain weight. So, and also feedings. So a lot of them have feeding tubes as well.
And things have come a long way in recent years. It used to be that these premature babies suffered long-term consequences, and they still can, but it's gotten better. From some of these treatments.
Definitely. We see a lot of babies that go on to lead very healthy lives, and we follow them and get to catch up with them as they grow and see them come back to visit. But babies are also at risk for long-term problems like cerebral palsy and blindness.
The blindness is from the oxygen, is that right? Okay.
So we follow that very closely even after they go home from the hospital.
Make sure they're doing okay and taking the steps they need. Now, let's talk about this before we go. Can premature birth be prevented?
In a lot of cases, the mom can do everything right and the causes are unknown. But the most important thing a mom can do is get early prenatal care and get adequate prenatal care. So staying, going to her doctor's appointments and following doctor's orders. A lot of times if there's a problem, hopefully they can catch it and try to prevent that. Also, not smoking or drinking during pregnancy is a big thing.
Wonderful. All right, we'll leave it at that. Thank you so much for being with us. Great advice there. And if you have a question about your child's health, just email me at ltucker@wate.com. And be sure to tune in every Thursday here on 6 News at 5:30 to see if we use your question on the air.